Hey everyone, welcome back. I am so pumped for this deep dive. You guys have given us a wild mix of sources this time.
Yeah.
Medical news research summaries.
Okay.
We even got a report from the Surgeon General himself.
Wow.
It seems like everything is pointing to some pretty major changes happening in healthcare right now.
It really does.
Like the kind of stuff we should all be paying attention to.
For sure.
One of the things that really jumped out at me was just how much AI is popping up everywhere.
Oh, absolutely.
It feels like it's not just a sci-fi fantasy anymore.
Right.
It's like AI is actually happening now.
It is. It's happening now.
It's pretty wild.
It is.
So, you're the expert. What's your take on all this?
Well, you're absolutely right. What makes this so exciting is that we're seeing AI making a real difference in almost every aspect of healthcare.
Really?
Yeah. From how we diagnose diseases to how surgeries are performed.
Wow.
It's pretty incredible.
Yeah, and it's not just a small impact either.
No, not at all.
This Moby Health news article we got predicts that the AI healthcare market could reach a mind-blowing $187 billion by 2030.
Yeah, I saw that.
I mean, that's a serious chunk of change being invested in this field.
It really shows you the massive potential that AI has to completely transform healthcare as we know it.
So how is it going to transform it?
Well, for one thing, it's about meeting the increasing demand for personalized care.
Oh, okay.
It's also about finding ways to lower healthcare costs.
Makes sense.
And ultimately, it's all about improving patient outcomes.
So helping people live longer, healthier lives.
Exactly.
That's great. So what exactly are we talking about here? The article lists 9 key areas where AI is making a real impact, and some of it is seriously mind-blowing.
Like what?
Okay, so like AI analyzing those images they take of your retina
Right.
to detect diabetic retinopathy,
Oh.
or how about this AI helping doctors find lung cancer super early
Wow.
just by looking at CT scans?
That's amazing.
I know, it's incredible.
Early detection is absolutely crucial for treating so many diseases effectively.
For sure.
And what's really amazing is that AI can help us do this with an accuracy and speed that humans just can't match on their own.
Wow. So it's like
Yeah.
AI is enhancing our abilities,
Exactly.
not necessarily replacing them.
Right.
And it's not just about diagnosis either.
No, it's not.
They're talking about AI-powered robots actually assisting surgeons in the operating room.
I know.
The article mentions that they can provide these crazy 3D magnified views for the surgeon and even analyze videos of the surgery to help improve their technique.
It's wild, isn't it?
It is. What do you think about that?
Well, this is what I find so fascinating about AI. It's not about replacing human skills. It's more about partnering with humans to enhance their abilities.
That's a good point.
It's giving surgeons the tools they need to perform even more complex procedures with incredible precision,
Yeah,
which ultimately leads to better outcomes for patients.
that makes sense. Then there's drug development. It sounds like AI algorithms are sifting through mountains of data on our genes to figure out what makes us sick and pinpoint how to target treatments.
Right.
And get this, they can even find new uses for existing drugs.
Wow.
So that means potentially getting new treatments to people a whole lot faster.
Absolutely. Imagine if we could develop treatments for rare diseases or conditions that have been really difficult to treat in the past.
Yeah.
And imagine if those treatments were available years, even decades sooner than they would be with traditional methods.
That's incredible.
That's the kind of impact we're talking about here.
Wow. One of the things that really caught my eye was how AI is being used in gene editing.
Oh, yeah.
Like actually treating diseases caused by problems in our genes.
Amazing.
The article mentions some examples like sickle cell anemia, cystic fibrosis, Tay-Sachs. Like these are really devastating diseases
They are.
that could potentially be cured with this technology.
It's true. Gene editing is a rapidly developing field with enormous potential.
Yeah.
But we also need to think carefully about how this technology is used.
Yeah, of course.
To put it simply, gene editing is like having tiny scissors that can go in and correct errors in our DNA.
Wow.
It's still very early days, but it holds incredible promise for treating diseases caused by faulty genes.
Okay. So moving on from the world of AI, there was this Lancet article about a whole new framework for diagnosing obesity.
Oh, yeah, I read that one.
I found it super interesting.
It is.
It feels like it's about time we moved beyond just relying on BMI, right?
Absolutely.
Yeah.
While BMI can be useful as a general guideline,
Yeah.
it doesn't tell us the whole story.
Right.
This new framework suggests that we should be thinking about 2 different categories of obesity.
Okay, what are they?
So there's clinical obesity, where there are actual measurable signs of illness linked to excess weight.
Okay.
And then there's preclinical obesity,
Yeah.
where organ function is normal, but the person has an increased risk of developing those complications.
Oh, I see. So it's not just about the number on the scale.
Right.
It's about looking at each person as an individual and
Exactly.
figuring out what's really going on in their body.
It's all about personalized care.
Okay.
This new framework is saying that we need to tailor treatment and interventions based on whether someone is actually showing signs of illness from obesity, not just their BMI.
So not a one-size-fits-all approach.
Exactly. It's about ensuring that people receive the right care at the right time.
That makes a lot of sense. This also ties into the ongoing debate about whether we should consider obesity a disease.
It does.
What do you think about that?
Well, the commission behind this new framework argues that asking is it or isn't it a disease is the wrong question altogether.
Interesting.
They're advocating for a more nuanced perspective,
Okay.
one that acknowledges that obesity can affect people's health in many different ways,
Right.
and that it's not a simple black and white issue.
So there's a lot of gray area.
There is.
That seems like a pretty reasonable take.
I think so, too.
Yeah.
It's about recognizing that everyone is different,
Yeah,
and there's no one-size-fits-all solution.
I like that.
Yeah.
So how does this new framework address the stigma that's often associated with obesity?
That's a great question. This approach is aimed at reducing that stigma
Okay.
and encouraging healthcare workers to treat people with weight issues with more compassion and understanding.
I think that's really important.
It is.
Okay, so this next one really grabbed my attention. It's the Surgeon General's report on alcohol.
Oh, yeah, that was a big one.
And I have to admit, there was one statistic that really caught me off guard,
I bet a lot of people were surprised by this report.
especially when it comes to how even small amounts of alcohol can affect our health.
Right.
They're saying that even light or moderate drinking can increase your risk of developing cancer.
It's true.
I think a lot of us, myself included, used to think that a glass of wine a day wasn't really a big deal.
It's a common misconception, and that's exactly why this report is so important.
So what are they saying?
Well, the Surgeon General is directly linking alcohol to 7 different types of cancer.
7.
Yes. Mouth, throat, larynx, esophagus, breast, liver, and colorectal cancers.
Wow. It's a pretty serious warning.
It is.
And the Straits Times article we got breaks down what those risks look like even for people who aren't heavy drinkers.
Right. It talks about the concept of absolute risk,
Yeah.
which is basically your overall chance of developing cancer over your lifetime.
Okay.
And then there's relative risk, which compares your risk to someone who drinks less than you.
I see. So even if your overall risk seems low, you're still significantly increasing your chances compared to someone who doesn't drink as much.
Exactly. And the point is, this is something we have control over.
Right.
We can choose to lower our risk by making changes to our drinking habits.
The Inventium article really brought those numbers home.
In what way?
Did you know that over 16% of breast cancer cases can be linked back to alcohol?
That's a scary statistic.
It is. And get this, alcohol is a factor in 100,000 cancer cases and 20,000 deaths every year in the U.S. alone.
It's a major public health issue
Yeah.
that often doesn't get the attention it deserves.
So where does alcohol rank among preventable causes of cancer?
Alcohol is actually the 3rd leading preventable cause of cancer, right behind obesity and tobacco.
Wow. That's pretty eye-opening. So given all of this, what is the Surgeon General recommending we do?
Well, he's calling for a few things, including updated warning labels on alcoholic beverages.
Okay.
He wants labels that clearly spell out the risk of cancer so that people can make more informed choices.
Makes sense.
He's also encouraging healthcare providers to talk about alcohol use with their patients
Okay.
as part of their regular checkups.
Because right now it seems like a lot of people just aren't aware of this connection between alcohol and cancer.
Exactly. And, changing public behavior is never easy.
Yeah, especially when it comes to something as ingrained in our culture as drinking.
Right. But that's the goal here.
Right.
Raising awareness and prompting people to really think about their relationship with alcohol.
It makes sense, but the InventUM article also points out that just knowing the risks doesn't always mean people will actually change their behavior.
That's a valid point.
Huh?
It's not just about giving people information. We also need to address the underlying reasons why people might drink excessively.
Right.
And that often means providing support and resources for mental health.
So it's a complex issue that needs a multifaceted approach.
It really does.
The report also suggests that we reevaluate the dietary guidelines for alcohol, which currently say it's okay for men to have 2 drinks a day and women 1.
Some experts are arguing that those limits are too high. given what we now know about the risks.
It's definitely a complex issue.
It is.
And changing those guidelines would represent a major shift in how we view alcohol as a society.
For sure.
But you know what's interesting?
Like,
They mention how narratives around alcohol are already starting to change.
oh, yeah.
Like how, you've got Dry January,
Right.
where people choose to abstain from alcohol for a whole month.
Mm-hmm.
And there's also this whole trend of mocktails becoming super popular.
It's true.
I think that's really encouraging.
Me too.
It shows that people's attitudes are shifting.
Yeah.
And that there's potential for real change if we keep raising awareness and promoting healthier alternatives to traditional drinking culture.
Absolutely.
Hmm.
Sometimes those shifts in perspective can have a ripple effect. We've seen how changing narratives can impact behavior on an individual level, but sometimes those changes need to happen on a global scale.
That's a great point.
Which brings us to that article you mentioned from Health Policy Watch.
This Health Policy Watch article about the mpox situation, particularly in Africa, it's a little unsettling.
Yeah, I agree. It is concerning.
It feels like we're dealing with another major disease outbreak so soon after COVID-19.
It does, and it seems to be hitting Africa particularly hard.
It does. The article mentions over 77,000 cases in the past year alone,
Wow.
with the Democratic Republic of Congo being the epicenter.
Yeah, I read that.
And sadly, over 1,300 people have died from the disease.
It's a lot of people.
It is. The article points to a few factors that are contributing to this surge.
Like what?
Things like issues with testing,
Right?
slow vaccine rollout, and gaps in community health programs.
Yeah. It's a lot to deal with.
It is. And then there's another layer of concern.
What's that?
Because the particular strain of the virus causing this outbreak, called Clade 1b,
Right.
seems to be more deadly than the one that caused that global health emergency a couple of years ago.
Oh, wow. That's worrying.
It is. So what's being done to address this? The article says that the DRC is trying to ramp up vaccinations, but they have hundreds of thousands of doses available, and it seems like they've only managed to administer a small percentage of them.
So what's the holdup?
Well, it sounds like there have been logistical challenges with actually getting those vaccines to people,
Ice?
especially in remote areas.
Makes sense.
But there is some good news.
Oh, good. What is it?
The Africa CDC director is emphasizing this shift to community-based vaccination strategies,
Okay.
which should help speed up the process.
Yeah, that makes a lot more sense.
Right, reaching entire communities is going to be way more efficient than trying to track down every single person who might have been exposed.
Absolutely.
And are they doing anything else?
Yeah, they're also sending epidemiologists and community health workers into those hard-hit areas
Okay,
to improve surveillance and case management.
that's good. So it's about being proactive
Exactly.
and trying to get ahead of the curve.
Right. But then there's this other complication.
Oh, no. What now?
China just reported its first case of Mpox Clade 1b,
Oh, wow.
linked to a traveler returning from Africa.
Right.
So it's clearly not just an African problem.
Right. It has the potential to spread globally.
It does. It really just highlights how interconnected we all are
It does.
and why a coordinated global response is so important.
Yeah, we've seen how quickly diseases can spread across borders in today's world.
For sure.
And we really need to be ready to act fast and work together
Right.
to contain outbreaks effectively.
It feels like we're constantly playing catch up with these emerging infectious diseases.
It does sometimes. And I think it highlights how critical it is to invest in public health infrastructure,
Yeah.
improve disease surveillance.
And really push for more research
Hmm.
into new treatments and vaccines.
You're right. We need to be prepared for that next pandemic.
Exactly. It's not a matter of if, but when.
Okay. On a slightly less grim note, this article about Singapore's use of AI in elder care really caught my eye.
Oh, yeah, I saw that one. It's fascinating, isn't it?
It is. It's incredible to see how they're using technology to tackle some of the challenges of an aging population.
It's a great example of how AI can be used to address very specific societal needs.
So what are they doing?
Well, in Singapore, they're facing this rapidly aging population,
Right.
coupled with a shortage of healthcare workers.
Yeah.
So they're turning to AI to fill in those gaps and enhance the care that seniors receive.
Makes sense. And they're doing some really cool things.
Like what?
The article talks about these AI-powered robots that lead exercise sessions for seniors with dementia.
Oh.
It's not just entertaining, but it actually helps to reduce wandering,
Really?
which is a huge concern for people with dementia.
Yeah.
And then they're also developing an AI tool that can detect early signs of depression in seniors.
That's amazing.
Yeah.
How does that even work?
It analyzes their voices.
Their voices.
Yeah. Can you believe that?
That's incredible.
It's like AI has this sixth sense or something.
It's picking up on those subtle cues that a human might miss.
Yeah, especially in a busy healthcare setting.
Exactly.
Yeah.
But AI can pick up on those and flag potential problems with remarkable accuracy.
And the article mentioned even more applications of AI in elder care.
Oh, like what?
Robots reminding seniors to take their meds,
Okay.
leading them through physical therapy exercises, even this really cool generative AI program that helps them write down their life stories.
That's amazing.
It's a pretty impressive range of applications.
It is.
Yeah.
And it's not just about practical support either. It's about improving quality of life for seniors.
What do you mean?
Things like promoting independence, encouraging social interaction,
Yeah,
even just supporting their emotional well-being.
that's great. But what about the potential downsides? The article does mention some concerns about privacy and whether this means we're replacing human interaction with machines.
Those are definitely important ethical considerations to think about.
Right, especially when we're talking about a vulnerable population like seniors.
Absolutely. With any new technology, we have to carefully weigh the benefits against the risks.
Yeah,
And with AI, we need to make sure it's being used ethically and responsibly.
right. Especially when it comes to groups like seniors who might be more susceptible to exploitation or manipulation.
I agree. Speaking of ethical considerations,
Mm.
this next article from UNC Newsroom really blew me away.
What's that one about?
It's about a new drug
Okay.
that could potentially revolutionize the way we treat food allergies.
Wow. Now that's exciting.
It is. This is a huge breakthrough.
So what is this drug?
It's called omalizumab,
Okay.
and it was originally developed for treating asthma.
Oh, okay.
But researchers have found that it can also reduce the risk of severe allergic reactions to things like peanuts and other common food allergens.
That's amazing. So it's like retraining their immune systems to not overreact.
Exactly. It's
Okay.
essentially desensitizing their immune system.
Wow.
And the really exciting part is that it seems to work for a whole range of food allergies,
Like what?
including peanuts, tree nuts, eggs, milkweed.
Wow. That would be life-changing.
It would imagine the peace of mind it would give parents of kids with severe food allergies.
I know. No more constantly worrying about accidental exposure or life-threatening reaction.
It's a huge step forward.
It is.
And it opens up the possibility of actually curing food allergies.
Instead of just managing them.
Exactly.
Yeah.
It's really incredible.
It does feel like we're on the cusp of some really groundbreaking advances in medicine.
I agree.
But as we've been talking about, there are also some very real challenges that we need to face.
There are.
It's a complex landscape to navigate.
It really is. And that's why I think it's so important to stay informed,
Absolutely.
to think critically about the information we're consuming, and to have those important conversations about the future of healthcare.
Couldn't agree more. Well, I think we've covered a lot of ground today.
We have.
From AI's potential to revolutionize healthcare
Hmm.
to this new way of thinking about obesity and those very real dangers of alcohol, even in moderation.
Yeah, it's been a fascinating discussion.
It has. We've talked about those concerning disease outbreaks that we need to keep an eye on and some really groundbreaking new treatments that are on the horizon. It's a lot to take in.
It is. It really underscores how interconnected all these aspects of health and well-being are.
I agree.
Our behaviors,
Yeah.
the environment we live in, the technologies we develop, it all plays a role in shaping both our individual and collective health outcomes.
Yeah, it really does.
It makes you think about the big picture, doesn't it?
It does.
And I think that brings us to the most important question.
What's that?
What does all of this mean for us as
Yeah.
individuals? You know, just trying to navigate this complex world and make healthy choices.
It's a big question.
It is?
And it can feel a little overwhelming at times
Oh, absolutely.
with so much information coming at us from every direction.
I agree. It can feel really overwhelming. But I think that's where knowledge comes in.
What do you mean?
The more we understand about these issues,
Yeah.
the better equipped we are to make informed decisions about our own health,
Okay.
advocate for policies that support well-being, and ultimately help shape the future of healthcare in a way that benefits everyone.
I like that knowledge is power.
It is.
So it's about taking control of our own health destinies.
Exactly.
Being informed, engaged, proactive, and
Yep.
recognizing that we're all in this together.
Right. Our individual choices impact our communities and ultimately the world around us.
Well said. Okay, so before we wrap up, I have one final thought-provoking question for you, our listener.
Okay, shoot.
We've talked a lot about AI's potential to transform healthcare.
We have.
So here's something to think about. How do you think AI will impact your own personal healthcare experience in the next 5 to 10 years?
That's a good one.
Do you think it'll make healthcare more accessible, more personalized, more effective? Or are there risks that we need to be cautious about?
I mean, there are always going to be risks, right?
Right. Like what about privacy concerns?
Mm.
Or the possibility that AI could make healthcare feel less human?
Those are definitely important things to consider.
It's a lot to think about as these technologies become more and more integrated into our lives.
It is.
And what about those Surgeon General's warnings? We've learned that alcohol carries some pretty significant risks.
Right.
So how will this new information affect your own approach to drinking? What factors will you weigh when making those choices? These are some pretty big questions.
They are.
And I don't think there are any easy answers.
No, not at all.
But I really encourage you to explore these topics further. Check out those links we've provided in the show notes. Do your own research, talk to people you trust, have conversations with your loved ones, your doctor, even with yourself.
Those are all great suggestions.
About what all of this means for you personally. Because ultimately, your health is your responsibility.
Again.
You have the power to make informed choices and advocate for the kind of healthcare future you want to see.
That's a great message to end on.
Thanks for joining us on this deep dive. I always learn so much from these conversations.
Me too.
And I hope you did too. Until next time, stay curious, stay informed, and most importantly, stay well.